Hey, this is Matt Bias with Taoist in Black here at Stonegate Wellness. Just wanted to go over something really quick. I was asked recently, why would someone want a medical qigong treatment? And the answer to that is for the same reason that you'd want an acupuncture treatment, why you'd want an appointment with a naturopathic doctor, with a massage therapist, with anyone else in the health and wellness field. That's just what we do. If you have any ailments, physical, emotional, you have pain or you're sick, we can aid in all of these things, and pretty profoundly. Now, I don't want to say we can go and cure everything for two reasons. One, there are legal reasons I can't say things like that. And two, because we really want to take things on a case-by-case basis. Don't want to make any broad statements saying, yeah, we could come on in and we'll get rid of your cold in 30 seconds. No. We have to see what you have going on. In a typical qigong session, medical qigong session I should say, you'll come in, we'll ask a series of questions to figure out what you have going on. Questions about sleep, about diet, about digestion. If you're a woman, we'll ask about menstruation, ask about some emotional things you might have going on, all to help us narrow down where the problem is, where your issues are really coming from. Everything is based in Chinese medicine. If you've ever been to an acupuncturist, we're going to do basically the same sort of thing, except for when the acupuncture points, when we go to use those acupuncture points, it's not going to be puncture, we're not going to use any needles, it's just going to be manual stimulation, so acupressure. We do a lot of energy work, energy or qi work, qi, prana, energy, it's all basically the same thing. It's different from Reiki. It gets compared to Reiki very frequently. I would say it's different. With Chinese medicine, we're working with channels and acupuncture points and organ systems. With Reiki, it's more typically just the chakral system. So you've got the 7 chakras within the body, and those get balanced. I do that too. Some medical qigong practitioners do Reiki as well. It's a case-by-case basis. It depends on their history and their schooling. So after the questions, we go to the treatment, like I said. Those are all going to be acupuncture points. There are different styles, though. My style is heavily based in channel theory. I use acupuncture points, and sometimes I'll use areas of the body that are not points. Like if you have soreness in an area that doesn't really lie on a channel, there's not a point there, I'm probably going to manipulate that manually. After the treatment, we'll talk about some things you have going on that you can change, be it diet or perhaps the way you sit in your chair at work, or the way you lift things if you have back pain. Beyond that, we'll show you some qigong movements, some breathing, some meditation. All really depends on what your chief complaint was, the reason that you came in. For example, if someone comes in with lower back pain, I'm not going to show them the same things as someone who is coming in with a cold or a fever. It's just not going to happen. Beyond that, that's about it. That's about it. These are swords. We're not going to use that in the treatment. Definitely not. And the windows are probably going to be closed too, for privacy. Alright. Once again, my name is Matt Bias with Taoist in Black here at Stonegate Wellness in Austin, Texas. Feel free to ask any questions in the comments below. Like and subscribe. And thanks again.